Okay, this is our case number 4, a class of cultures case study. A little bit of background. According to the WHO, female genital mutilation involves the partial or total removal of external female genitalia or other injury to the female genital organs for non-medical reasons. It has no health benefits for girls or women, and FGM is associated with increased risk for infections, complications, and newborn deaths and difficulty with urination. However, it's considered an essential practice in Africa, Asia, and the Middle East. And in this case, we are going to approach the implications of maintaining cultural sensitivity as a healthcare provider while practicing under personal morals, professional guidelines, and the law.
Okay, so question 1 is, what is the scope of practice for each professional named in the case? And so for the nurse, she's a mandated reporter. So Barbara has the responsibility to report any suspicions of child abuse or neglect. And specifically in this case, she believes that the parents are responsible and that they're trying to do what they believe is best for their daughter. For the pediatrician, it is not her responsibility to identify the intent of the parents, but it is her responsibility to report her suspicions and let professionals conduct an investigation if she thinks that it's necessary. The social worker is also a mandated reporter, and she has the responsibility to report any suspicions of child abuse or neglect. And she too, like Barbara, doesn't believe that there's any reason to do so in this case. And then the pharmacist, they should dispense the required drugs and devices should the pediatrician agree to the procedure and prescribe them for the patient.
Personal feelings aside, what role does an interprofessional team have in engaging parents? As a team, all healthcare professionals have to ensure that both children are receiving the best treatment possible and communicate any concerns or necessary actions. So the doctor should present all options, make sure the parents are aware of any dangers involved, provide the best treatment to make sure the baby is healthy. The nurse can check on the infant's vital signs and health. The social worker can make sure both children are not being harmed or mistreated, are now healthy and being taken care of. And the pharmacist can make sure that the medications are correct and check for possible allergies or interactions and presenting any issues to the rest of the team.
The patient urging the social care worker may help, as the social worker did explain the modified surgery that may be a better option, but the social worker and nurse should keep informing the doctor of repercussions the child might face and that this procedure is more safe done in his hands than in unsanitary conditions. The doctor urging the social worker to call CPS will not be enough because the social worker understands the family's needs, and the CPS will also understand the cultural aspect of this procedure. The family will still get the procedure done somewhere, but the child will be at risk of many more permanent issues if done in an unsafe manner.
The U.S. government actually lists female genital mutilation as child abuse. Past the age of 18, a woman can consent to the procedure, but under the age of 18, it's considered abuse. Family protective services should be notified, at least in Texas. Depending on your jurisdiction, other state and local authorities may be notified. Police can also be called if unsure of where to file the report.
In regards to the terms used around this type of procedure, there is other terminology that could be used to not be so offensive, but still remain medically correct. But no matter what, it's always going to bring about an ethical dilemma based on like legality reasons, and they are very sensitive terms and very raw to hear terms, which it kind of brings about a negative connotation in terms of cultural harm and insensitivity to the patient because they're not getting the choice as to if they want this done or not. But in the end, you just want to make sure that you keep the patient's dignity at the center of your care, which includes the vocabulary used to address their care.
So question 6 is, how does cultural sensitivity play into this case, and how and where do you draw the line? So Mr. and Mrs. O come from a country that value FGM as an important part of their child's prospective future. So to them, this is a commonplace practice with implications that are lifelong. and to them, this is in their child's best interest. So by Dr. Samuel stating that this practice is primitive, he's exhibiting total disregard for the family's upbringing. So instead, he should focus on educating the parents on the risk of infections, complications during childbirth, and the overall decreased quality of life that can come with FGM. So he should explain that FGM is outlawed in the US under the Female Genital Mutilation Act of 1966 and is considered medically unnecessary by the American Academy of Pediatrics. So he should inform the parents that he's bound by his personal and professional ethical beliefs, as well as the law, and that he will not perform the procedure.
In conclusion, as healthcare providers, it's important that we maintain cultural sensitivity in regards to our patients, especially in cases that seem widely outside the realm of the societal constructs that we grew up in. It's essential to help our patients feel heard while at the same time educating them on potential complications of medically unnecessary procedures. And at the end of the day, both parties want what's best for the patient. And it's important that we as future healthcare providers make that known to our patients and their families.